And roll it.
Good morning. My name is Harrison Pierce. I'm the Chairman of Health and Human Services. Thank you all for attending. First item on the agenda is the approval of the May 2nd, 2024 minutes. Any questions, corrections?
Motion to approve.
Motion to approve.
Second.
All those in favor?
Aye.
Opposed? So be it.
So be it.
Motion carries.
Reports, Health Department.
Okay, so I sent you all my report with all the numbers and data for environmental health. May and June are always our busiest month with all the relicensing. Some updates to the report that I just sent 2 days ago. All the pools, the public pools have now paid. 3 have still not been inspected because 2 condo pools haven't even taken off the covers yet, but at least they're paid. And New Canaan Country School always gets inspected at the end of the year for their outdoor pool because it's only for their summer camp. The salons, we're in the middle of the relicensing and inspecting all of them. They are all due by June 30th. 24 out of the 41 have submitted for their relicensing. 20 are fully relicensed and have everything they need.
41 salons.
Yeah.
That's right.
Yeah. The truck inspections and the relicensing on that, the garbage trucks and the septic pump trucks have started. I had inspections yesterday at the transfer station. And next Wednesday is the last date. Gino's going to do next Wednesday. So far, an update to that, we have 41 trucks that have submitted for relicensing and 16 out of the 18 companies. We still have 2 companies that are being a little difficult. Moving on, FEP grant update. We had our monthly webinar on responder safety and health. The FEP grant itself, we're in the last month of this 5-year period. So July 1 starts the new 5-year grant. The grant went from 11,708. It went down slightly to 11,393. It only equates to 8 hours of the whole year being reduced. So it's not anything earth shattering because it's not enough to cover all the work anyway. I split the work with our part-time coordinator. Once that grant language is finalized with the Attorney General's office, I'll have to go to BOS for their approval, obviously, because it's over $10,000. Next week, I'm meeting with Silver Hill, the new head of security, Daniel Medeiros, and Kevin Havey, who's the director of facilities, to go over their preparedness plans because their old one, Peter, resigned. So I just want to catch them up with the date because they're one of our partners, our preparedness partners, and give them, how everything kind of works. Next Wednesday is the governor's statewide exercise at Fairfield University. It's going to be on 9 modules, but it's on elections. So normally we wouldn't think you'd be involved, and we were supposed to have the commissioners DPH meeting that day, which we're required by statute to attend. But they're adding a little scenario for public health with white powder anthrax. So that's why we're involved. I do have the anthrax local plan up to date and the MCM plan, the medical countermeasures plan, which is really the real role of public health in anthrax. Cipro, doxycycline to, dispense. So that dispense plan is up to date. I gave it to Russ Kimes this morning. So we're on the same page. Immunization grant update. I just submitted the Q3 financial report and core CT and the progress report, which progress reports on the deliverables of, how many clinics did you do? How many, education, all that jazz. The total reimbursement for the last one was $6,882.44. There's a little bit of remaining funds, but they did what they call a no-cost extension through June 30th of 2025 for all the grants, not mine, just mine. All the salary and fringe has been used up, but I still have $1,154.62 for medical supplies for next year and another $692.15 for office supplies. I did send our finance department to our CFO and budget director the whole gist so Ann doesn't have to go into Core CT and click on every single report. I send her a nice little summary of everything for the year. The workforce development grant starts July 1, which again will be covering Ellen's salary for the next fiscal year. That's $45,030. Community health, we did the May mental health event at Waveney House. The QPR suicide prevention trainings, we continue at the library. The next date is June 21st. The blood sugar diabetes screenings with our nurse Ellen at Lapham and Schoolhouse. Lapham and Schoolhouse have continued. We also will be taking over the blood pressure clinics for Bethany at those areas because we're already there anyway. So our nurse Ellen will handle that. That's no issue. We also have begun advertising for the back to school immunizations because even though they're not even out of school yet, they're due by August, and that includes even the preschools. I posted on Facebook. I will be sending out through Everbridge. As I put in a report last month, we have a new communications way with Everbridge, which I love. The first select woman, Deanna, sends out her newsletter, and then people can pick their buckets. Health department's one of them. So now I have a much larger base to, let know about everything that's going on, and it has significantly increased people attending things and knowing what's going on. So it's been wonderful. I'm very happy that Deanna did that initiative with Russ, so people are, know what's going on. We're also holding a free skin cancer screening clinic at Schoolhouse Apartments on June 24th. We had done one in the fall, if you all remember, at Irwin for the general public. This is just for the schoolhouse, and that's with dermatologist Elle DeMole, who's also a New Canaan resident, and she does it pro bono. So we're very appreciative of that. We had already done like a pre in April of why it's important for them to get screened for skin cancer. And we will be building the booths again, the vaccine booths. We kept the pipes and the curtains, so we make it double wide. So if they want to do their whole body, they can, or if they want to just show a spot, they can. Yep, because they don't have transportation, and that's why we bring everything to them. Basically, you're doing carbon copies of what we do at Lapham, but Lapham people have transportation in this way, And we're also starting a Walking for Wellness Club. They're going to meet at Lapham and then do in Waveney, and that's with Shannon and our nurse Ellen. I sent that out through Everbridge, and we already had 11 people signed up, and it's a great way to get the seniors a little more physical activity and, meet some new friends and social isolation purposes. The training updates, you have all there of all the trainings we had to go to. And because a lot of our licenses, you have to maintain and do these things. Like the lead is required by statute every year. We have to do 8 hours and retake the test. So Shannon and myself went in May, Gino went in June and April. And then I just want to point out on the charts, because I think it's pretty significant, the suicidal ideation was rather alarming for the last 90 days of the numbers. I don't know how that coincides with the Silver Hill Urgent Assessment Programs. I'm not part of that, but I'm sure now Marcy will let us know on that. But I did just want to make sure you guys really looked at those charts.
Quick question.
Yes, Jim.
It has changed over the years. What's regional now amount to in terms of, is that Fairfield County?
It's not all of Fairfield County, because Fairfield County goes up to like Danbury, New Fairfield. It's the 14 towns from Greenwich to Stratford.
So these numbers are not New Canaan numbers, is the key point.
Oh, no, they are New Canaan.
No, these are New Canaan.
Yeah.
These are only New Canaan.
For suicidal ideation, this is New Canaan only.
That's one every 5 days.
Yeah.
Jen, just
That
a-
makes it-
Yes, Tom.
Okay. Question on that report on the suicidal ideation. Is there any reason to think we're capturing more information as opposed to people getting more desperate? Is there any?
Well, there's two ways to look at this. At least they're seeking help. I mean, granted, the
Okay.
ED is not the ideal place to get the help. But the problem with these they're not reportable diseases. So I don't get any of the background data. Where if it was a reportable disease, you know, say TB or COVID or whatever, I can see all the hospital notes of what's going on, who the person is, where they live. That here, I get nothing. I don't even know the name, but we have the age group and the data of it. So I don't really know what's, as you see, the age groups go from 10 to 64. I mean, it's across everything except the very young and the 65 and up. So it's,
I would.
and it's pretty evenly spread across every one of those age groups. So as we talked about your visions for the future or your focuses, again, mental health should be at that forefront.
What I think and Commissioner Barksdale, again, Tom, these are ED visits. So these are people, this is only people that show up in the emergency department. This does not include people that come through our program and maybe be referred out to another program. So the number is even much larger. So I would see, you know, bringing more awareness to it, maybe increasing the number. But by the time you go to the emergency department, I think that is, by that time, I think you're in true crisis.
Barb, I just have a question too. It concerns me that it seems like consistently females are a much higher group. I know it's a small sample, but is that true across a larger sample of, you know, maybe the county, or do you know whether that's, or is this just,
you know,
arbitrary?
for the next report, I'll look up the state data as well, and just to give you a comparison. Or actually, even after this meeting, I could do that. And then I'll send you guys the email of just to see if we're in line with the state or if we're some kind of anomaly.
Generally, on it 3 times.
The girls are 3 times? Women are.
Well, I can tell you, like in high school.
Yeah, well, that's what I'm wondering, if it's related to the social media.
3 to 4 times men, which is super jarring.
What's interesting is ideation tends to be more prominent in females, but completion tends to be higher in males.
Oh, interesting.
And so that's where the data typically shifts out. And in terms of, you know, for lack of a better word, the courage to complete, right? It tends to be higher in men, whereas women will more typically seek help. From an emergency department perspective, what often happens is it's either people who don't have resources to get help otherwise come to us, even if it's a relatively minor perspective of suicidal ideation. And suicidal ideation is a really easy code for us to do in the emergency department. But then otherwise, or it's people who are very resource rich, who are at extremely high risk and have been referred by their mental health providers to the emergency department. So it almost captures extremes of like resources, if that makes sense.
Yeah. Okay, thank you. That's
and the elderly are also more, from a percentage standpoint, more successful in completing the suicide than the younger population in terms of having the ideation. There is that, like there is for male and women, there's also in the senior population in terms of not only have the ideation, but completing the suicide.
Is that
signals the seriousness of distress and mental health challenges
for both sexes,
but continues to go up.
Yeah.
And I'm hopeful that New Canaan Community Foundation, these are some of the questions that they're going to ask, you know, through the community assessment that they do. These are the key points.
You know, Harrison, you've got Lauren coming next month, which I thought was a really good move, but they're really open to taking on, and we should think ahead of time about what we want to prioritize and emphasize. So they're ready to put into the questionnaires the stuff that we're most concerned about.
Yeah, she wants to meet with us as much as we want to meet with her. Peter, when you went over the statistics at our last meeting, I was kind of negatively impressed. I thought that that was disproportionately high. I did attend a meeting with the Stanford Hospital Pediatric Department with psychiatrists to do suicide in kids. And the numbers, I may be off, but it was about 26% of high school kids had contemplated suicide. I don't know where that fits with your info. So that was alarming to me. So yeah, many topics to be explored and not resolved, but whatever. Jen? That's it. Finished. Thank you so much. Human Services Department. So Bethany is not here. Unfortunately, she is sick. She texted me last night, told me she thought she had food poisoning, and at 6:21 a.m. this morning, she
confirmed it.
Confirmed whatever it was. I thought it may just be one of these summer viral things, but she's not here. Yeah. So I am going to just scoot through some of these little issues that I did have questions about or wanted to point out under her part. You did receive anyway her report, correct?
Yeah.
One was this is a change. The farmers market voucher program will not be offered by the food pantry anymore. Opioid settlement, will deal with that later under old business. Blood pressure clinics, Jen mentioned that Bethany asked her to take over the blood pressure clinics. This is all in light of Bethany Zara resigning her position as director of Human Services. I had questions about small town directors meeting, which the next appointee, interim or whatever, will be attending. Bethany's on some boards too, the Get About board, and they have monthly meetings. Farmers market will need a liaison.
Kirsten, can you back up? I'm sorry. Did you say that the voucher program is no longer being offered?
The
farmers market?
Farmers market is no longer, the voucher program is no longer being offered. I think this is related to the perspective on the town and the budget, et cetera.
But it's donation based.
There still will be a state one for seniors though. There's a state farmers market senior vouchers that the schoolhouse residents will still be receiving.
I've had a couple members of the community come to me about this already and felt like I had no idea what was going on or how to answer. So I would love just a little more information on that to be able to respond to their concerns. I'm not sure, was that program not being used? Was it seen as kind of superfluous? How's the budgetary issue? What's going on?
My perception, and not knowing the total answer here, was this was just part of a new look at the budget and that situation. Marcy,
That's what I understand. It's just a budgetary thing that.
Do we know how many people were using it, or
I can get those numbers for you.
$4,500 out of the $7,500 that's offered is used. So it's out of the food pantry budget, which is donations, not tax dollars.
Yeah, because that's the other thing that was confusing to me. If people are donating privately, why would the town budget? To be honest, the Gospel Garden at St. Mark's donates fresh produce to the food bank throughout the summer. So it's more of kind of like a larger overview, kind of a principal issue, because when people come upset about something and wanting to know, but I guess I'm still not clear, just the budget was cut.
Last year's numbers on how many were given out and how many were actually used.
But it sounds like it wasn't a usage or a numbers thing. It was just a.
Did you get any calls at all, Human Services, asking why it was closed or anything?
I have not.
No.
Yeah, this would be community members who are not using it, but are involved in it and were.
We'll get the answer for you by our next meeting.
There is a process issue though, because realities of budget, that's a real thing, and if there's a need to tighten belts, I think we certainly be responsive to that. It'd be great to have input, because we'll have our own sense of things that have most value, and tough decisions are part of what everybody has to do, and I think we'd be open to that. But if we can have a voice as just one of the inputs into that from a almost efficacy and impact point of view, so that the folks who decide the actual numbers can get the benefit of our insight. That would be probably wind up being a better process overall.
Good point. The bereavement group, Marcy is involved with that, and will continue to be, and the Buchanan Behavioral Health Alliance also. And Marcy's put information, which a report which Bethany usually presents. I had one question down there for Marcy, just the referral to outside agencies, 5. Which agencies are?
2 were to the behavioral urgent assessment at Silver Hill, and 3 were to SWACA. They were like family members concerned about parents and understanding what, you know.
Yeah, just going forward, it's good to know where they're going, what agencies we're using, because at the end of the year, when it comes time for grants, et cetera, this is part of our background information.
Yeah.
And Jackie DeLuey's report also. Buchanan Urgent Assessment. I think we'll just looking at this. We've discussed this X number of times. We're pretty stable there. No increase, no real decrease. Onward going. There was a meeting yesterday at an urgent assessment. Cheryl, did you go? Or
I did not.
No. Did Marcy, did you go?
I did go, yes.
Any new information?
No new information. The numbers are about the same as last year's. Speaking of suicidology, it looks like 16% of the presenting complaints were that. The majority were anxiety, depression, behavioral dysregulation, and mood dysregulation. So suicidality came in 5th on that. About 16%.
The diagnosis, as I recall, are not usually exclusive.
Exactly.
Right? So
they could be like dual
depression and suicidality.
100%. Yeah. The age range was 21% were children, 26 adolescent, 17% young adult, 28% were adult, which is 27 to 60 years old, and the older adult actually did go up from last year, and that is at 8%. So
you can see the substance misuse too, which is 9% now. That number is increasing. Okay, so we'll move on to old business. Agency liaisons. I know, Barb, you've been in touch with Meals on Wheels and Jen with Child Guidance. I met with the Teen Talk counselor at the high school, Martha, and Colin Brzezinski, who's part of Kids in Crisis. And I think we just want to have a good knowledge base when we come for grant decisions, and just each of us know our own little agency too.
I've met a couple times with the head of Get About since our last meeting.
Okay, that's great.
Yeah, and I'm just going to add that I met with Steve Vandegraff at Meals on Wheels, and we had a nice long conversation. And the thing that happens, but every time you do Meals on Wheels, that happens is you look at some of these people and you think, wow, it would be nice if someone could really help them, if they were willing to have help. And as we all know, people are often a little, especially the seniors, a little afraid to admit that they need help. But he seemed very interested in trying to help us, move that kind of thing forward and be. I said, you can't force anything, and you certainly don't want to call Bethany and say, why don't you pop by, or Marcy, because people are, they're resistant. But it was good to hear their perspective, that they're very concerned about seniors and the people that are. Some of them are younger, but just that we have support there too.
So I had spoken to Bethany briefly before she left, because my thought was, we're covering all the agencies. There was one that we're not covering, and that was Human Services. So I fleetingly mentioned it to her. She came back. I was going to discuss the role of having one of the members be the liaison with Human Services. And Bethany came back. She met with our first selectman, Deanna, and Deanna had suggested, why don't you get someone, the liaison person for Human Services? So it was coming together. So I thought of the perfect candidate. That happened.
Oh no!
That happened to be Russ Barksdale. So Russ Barksdale is our liaison person for human services. Everything is timely. There's some ulterior meaning to everything. You are the one. Russ obliged to serve, which we're very happy about. Thank you, Russ.
Thank you, Aaron.
Should you decide to accept.
I didn't know it was option.
So what's the division of labor committee chair who historically that, you know, has a lot of the interaction with these folks and then Russ, just so I understand that.
This chair?
Well, you will just
like with everyone, it's just gathering information. I guess it ends up here, ends up with the director of human services, so we can be involved in decision making end of year, et cetera. And you know, if we have suggestions or they have suggestions, we act on that, and then we present our perspectives and our knowledge at the end of the year in determining grants. And when things need some correction or adjustment or recognition, attention along the way, we do it. Answer it or no?
We had a good meeting. Beth and I did, went over, you know, job descriptions, went over a couple things, and whenever it's appropriate, I know we have the one issue in terms of the USV grant, and if we, so I have the details behind that. If you want to make it part of the discussion, it shouldn't take more than a minute or two, but it's up to you.
Well, this is just a grant from the government to Youth and Child Services, and how that money is allotted. And, you know, if we have it under Jackie's report in here, where it goes, you know, supporting camps. It's Live Girls or Live Girls, whatever is, you know, they are recipients. There are a number of, and speakers throughout the year addressing different things addressed to teens and families and what have you. So that's where the money is spent. So it's overlooking, part of Russ's job will be to overlook that, make sure it's spent appropriately. We like where the money is going. We agree with the decisions, et cetera.
It's about, what's exactly $31,412. And I have the details if anybody's interested in how the money was allocated. But the question that I had was, just like with all of our grants, should we in the future have oversight, at least a presentation to approve the grant funding and the grant programs that it goes out to? So I just asked for, you know, your consideration. My position to Bethany is that we should, that, you know, if a grant comes in, and we should, of course, rely on our human services professionals to say, here's how they would like to spend the money and why, and that we have some oversight of that.
Thank you. Next item is the real contract. So there was almost no usage of that initially. And there was an adjustment on the website, et cetera. So the usage did increase somewhat. But because of the low usage, we had mentioned this before, that we had to give them a 3-month notice that we would not be continuing the contract, probably, but in that 3-month period, we had time to wrestle with it. To date, there have been 21 hits over the last 6 months on the real site. And if we look through the information that Bethany sent, comparing that to our new behavioral health, you know, analytics, the numbers are just don't compare. So the event counts, the users, et cetera, are much more significant with the New Canaan Behavioral Health, which they do use for substance abuse, et cetera, too. So her recommendation was not to continue, and there was lengthy discussion. Unfortunately, she's not here, but she has spoken to the people involved with REAL. And
Harrison, has it been advertised to anyone? Like, if Human Services needs me to send it out through Everbridge, I can.
It was advertised initially, but not as successfully or maybe thoughtfully as was hoped. But when they did make that change, there was a slight bump in usage, but maybe not enough to continue it. It's up to us as a commission to decide whether we continue or just let them know this is the end. Contract ends tomorrow. One pro is that it is New Canaan based somewhat. There are other people involved. The other one is you hate to sell 21 hits. You hate to turn that off of those 21 hits and people involved. But there are other avenues. It does cost money, and we are in a budget examining scenario here.
What's the option if someone doesn't use Real? Let's say we pull the plug on that.
Yeah.
What's
So
the go-to?
it's the New Canaan Behavioral Assessment Alignment website. Okay. And that's the one that's really getting a lot of usage.
All right.
It has gotten a lot of hits. I don't have any of the numbers. I think Bethany may have emailed those to everyone, but that has gotten a lot of hits. And it's sort of got a bucket of everything that's.
Yeah, I think that's part of the reason it's not been used is it's somewhat redundant to all the other things that are going on in town that are much better marketed and et cetera, et cetera.
Will it be shut down if we don't fund it, or is it?
Yes.
No,
they'll find out.
Yeah, it's shut down here.
Well, they won't
Shut down here, but
yeah,
they'll continue to do their work. You
but
just
here,
won't have
yeah.
it part of our
Correct.
stable.
You would have to, join as a privately yourself, right?
Do you have insight into this? I mean, I know you recused yourself, but you know, we need some information.
I mean, I'm an investor, so I'm recused. So this is an awkward moment, isn't it?
Wear your other hat.
We trust you.
They've got business that's happening elsewhere. It's not totally dependent on this. So.
Well, I can say that Silver Hill is a registered user of the program. So they have, if you are referred through Silver Hill is in contract with the Real program. So.
Oh, so maybe through urgent assessment they pick up.
I don't know that granular detail. I do know that Silver Hill does participate in the Real program.
It's offered to their
patients,
clients.
It is.
I do not know what the usage at Silver Hill.
I do
whether they're happy with the program or.
I'm not the liaison. I'm over here.
Over there is everywhere.
One of the things when I was meeting with New Canaan Cares, one of the things they had mentioned was really trying to highlight and kind of the local prevention council work that they do. Have they been involved at all with Real or kind of the deployment of that? I
do not think so.
Okay. Because that's one of the things that they kind of mentioned is it feels like there's certain things happening in like different silos. And if they're going to be the local prevention council, like to just being more engaged, which I thought was absolutely valid and made a lot of sense. And so I know they're well up to speed with the urgent assessment program, but I'm not sure. And I can come back to them with that. But
well, we were offered an extreme discount at rate, and if we're terminating, if the commission agrees to terminate, I think maybe offering that to any other organization that maybe wants to continue it, I think that's a reasonable referral.
This is $500 per month, correct?
I thought it was 1,000. We've spent 3 so far for a quarter.
Yeah, I thought it was 500, but whatever. It's in that range.
Yep.
Should we, if we can do this, continue it through the summer? See what kind of play it gets? And then decide, or we decide now? I think based on the numbers, if we decide now, it's just to discontinue the contract.
I have no information to have a point of view on this.
Well, that's very helpful.
No.
Barb.
We were 0, then we went to 21 over.
Right, which was my question. Was it sent
It's not
out to
0.
all
Should we
these
give it
groups?
another-
Was it
Should
communicated?
we do a big push? Why don't we
Yeah.
go to New Canaan Cares, and why don't we send it out on Jen's newsletter and give it? Oh, what?
Well, we have $26,000 left that's unspent so far that's in the bank for opioids. So spending another 3 is doable within the plan.
I think the only issue to think about the Behavioral Health Alliance website.
Right.
Like,
Oh,
every
absolutely.
organization
Yeah.
is pushing that. It's a real collective
And
effort.
that is getting a lot of hits, and that is getting a lot of like unique users and
Yes.
repeat users. And
How do those two compare? Now, I confess not having looked at them, but how do they compare in terms of the information provided and usability and all that?
well,
Do we know?
I think there's a lot of similar information being.
I think there's a lot more deep content on the real thing, but in
Mhm.
terms of referral, where to go,
Yeah.
which is kind of, we've always known that's one of the main needs. That's what health
Does
is, 'cause it's
Does the
very
behavioral
comprehensive.
health thing refer you to real? You go on there for that in-depth stuff.
No. And I think Real also deals with the children, the siblings, the parents.
Parents.
That was the
How the
parents, that's what I-
how the
Parents.
parents can
Sure.
deal with it. And so you're not looking, you're trying to reduce recidivism, you're trying to help the families deal with it and the children, the siblings to deal with it. I think, and I know Peter's Investment, and we know Todd Lambert was one of the originators of it in town. That's where they were focusing a lot of attention and very detailed programs that could be employed and groups. You didn't feel isolated and alone. You had a resource to go to. So I don't believe it's a duplication of something that is occurring right now. I think it's an augmentation of it and certainly could help. Whether we should be funding it as a commission or we should help support another organization to doing it, then that to me is our job. We made I thought we voted 90 days ago or so that we were going to give them notice and say that, here's areas we like you to improve upon, like marketing and outreach and things of that nature. But we needed to see the data, and I'm not sure we have enough data at this point to make that decision, or to have a conversation with another nonprofit that's in the area that's willing to take that part of it on. To me, that would be something to be potentially an easy fundraiser for people to say, here's a great resource for families and whatever. I know
You had a 30-second paddle raise, you'd get there.
We've seen that in action, yeah.
Yeah.
We all seem a little stymied by this. Maybe we should just wait.
Yeah, I think Jim's point is well taken. We have some opioid money, which we may possibly use. The New Canaan Behavioral Health Analytics are big, the numbers don't compare. But is there a little niche within that New Canaan Behavioral Health Analytics thing where Real may serve a purpose? It's parent directed, etc. Correct, according and with Tom, maybe we don't have enough information right now other than the pure number statistics. So would someone make a motion to continue this for the next 3 months?
I so move.
All those in favor? Aye.
Aye.
Opposed? Okay.
And I'll reach out to New Canaan Cares and
That'd be
see.
just gonna ask.
The only addition to your motion, Harrison, and you passed unanimously with one recusal, but I would also say for our liaisons, let's reach out and see if we can't find someone that can delve into it and see if it's more appropriate for them to take that off of our grant.
Yeah, we will let Real know we're continuing this for 3 months on a trial basis. So on 3 months, September, if we do want to discontinue, we can do that.
Okay.
The opioid settlement, Jim, we have $26,000 to spend.
Net currently, interestingly enough, in looking into this, it's almost $250,000 worth of revenue for the town as our portion of this. It's easy to spend it. We've already spent $63,000, now $66,000. But we still have $23,000 to spend, and we need a discussion at some point, probably after Lauren arrives, to see what foundation is doing and where, and actually we should check with New Canaan Cares and the coalition as to what their point of view is on REAL, whether we're going to continue or not. But anyway, sometime during the late summer, we still have $20,000 to figure out what to do with as the town. And part of that is Deanna's decision. Part of it is the commission's recommendations. And so when we use this new extension, that'll help push more information into the system. And so by fall, we should know much better what our options are, because we could continue to spend more money with the same 3 people, ex-REAL, that we already have spent money on, or we can find new places. And so my hope will be we'll be smarter in the fall.
Jim, is
but
there
we still have money, and we still have money to go. Right. There's still basically we got $250,000, 247.6. We still have, where did it go? $139,000. But the interesting thing is that there's, and Bethany went to a thing, I don't know whether she shared that with you, with the staff, that Demas in Hartford, it gets the major part of the money to manage. And so I still don't understand, nor did Bethany, how this was supposed to be 18 years of money spread out, but we already have $70,000 basically, or $80,000, $90,000. So that didn't come in on, you know, that all came in much faster than expected. Yeah. So right now the idea is that this money is going to drag out over a period of another 11 years or so. Yeah, that's what I was going to ask you. At $12,000, $15,000 a year. And
do we have that in writing anywhere?
Well, that's you just hit the nail on the head. That's the problem. I didn't, the Demas deck and that discussion looking at how they're going to spend the grander funds had none of that information. A lot of missing pieces in this. In the meantime, Demas is spending 85% of that money coming into the state is spent by Demas and with general promotion, and they have a whole bunch of.
Well, I just look at something like the ARPA fund.
Department of Mental Health.
Okay.
Department of Emergency Management and Homeland Security.
Okay.
The concern that I have is similar to what happened with the ARPA funds, right? The ARPA funds were coming and everything. The state was sitting on it, not spending it. And then all of a sudden feds come back and go, that's it, we're done. And I would like to see something in writing or a position paper from someone on, are these funds, if we don't spend them, going to be taken away? Or
good point too. Yeah.
Okay, so I would hope our CFO, the town CFO, would have that type of detail, because I'm sure they have to put it in their balance sheet in terms of an asset or
receivables.
Through my other nonprofit stuff, I've done a lot of work with Demas over the years. I cannot believe they gave them all this money to spend. I mean, that's the last place in Hartford I would have gone to do something that was educational and et cetera. However, it's fact. And again, 85% of this, what was $600 million is going to Demas.
Wow. Especially for them not to be able to
and
say exactly what's happening.
The fact that we cannot,
there's no accountability,
this level
that's insanity.
Of figuring out what to do with our money because we don't know what.
I make a motion that we ask the town CFO, really, because this is to me, it's a balance sheet item. It's a grant.
Yeah, well, there's a specific person that Bethany talks to in the accounting office that looks after this account.
Well, again, I still would, make a motion that CFO actually write us a position on how the asset is and what the real numbers are. I do not want to get, as a commission, as one commissioner, I do not want to get caught into a numbers game again, where the money's not here, it is here, it's been spent, it hasn't been spent, and I'd rather do our due diligence to have the CFO give us something in a response in writing that we can reaffirm.
The reality of the moment
Balance.
is that we have this 26,000 in the bank to spend, to figure out how.
Okay.
We just spent 3 of it. We have all this other money coming eventually, and nobody seems to know how. But right now, Demas is saying that it's going to play out over the next 10 years or 11 years. But that's not the way the money has come in so far.
Sounds like we need some clarification of
A lot of
accountability.
clarification.
We'll look at that. Bethany has been talking to the town CFOs.
There
Yes.
is a motion on the floor.
I second Russ's motion to get more solid information and
Well,
to use the
particularly with the
CFO to
change
do that.
of management, makes sense. But we have an update from last week. That's starting point.
All in favor?
All in favor?
Yay.
Aye. Doing well.
Miss Roberts rules over there.
Every night.
I'll get you to sleep quickly. All right, so, unfortunately, we all know that Bethany Zhao has resigned her position as Director of Human Services. I think it's a major loss, my perspective, probably others. Anyway, so we're going to move on. Next topic, Human Services Department, and Deanna Carlson, unfortunately, will not be here. But we do have Cheryl Jones, Human Resources. Filling in. Thank you for coming, Cheryl.
Good morning. So just to bring everybody up to speed, as we know, Bethany did resign. Unfortunately, she can only give us 2 weeks. So with that timeline, Deanna took to the Board of Selectmen, putting Marcy in as the interim Human Services Director. So I think we are in good hands. She is a social worker, licensed, graduated from Columbia. We spoke yesterday about putting a 90-day plan together as to how she's going to take this on. And I think presenting that to the commission will be helpful. And so I guess turn it over to you maybe to just say a couple words.
Like Cheryl said, it's going to be a learning curve, and I actually am grateful that it is during the summer when we are a little quieter and I can really get my hands dirty and have time to really learn exactly what it is that our department needs and make those our priorities, and really figure out where it is that we're lacking and where we can make more of an impact. So that's my summer plan.
Good. That's great. Good plan.
That and getting somebody ready for college, but that is the plan.
I think we're very fortunate to have Marcy.
Absolutely.
Here.
Absolutely.
That being, and thank you.
Marcy, if we can help you,
thank you.
Please let us know.
Yeah, anyway.
Right? Call us all.
And you know who your liaison is.
Yeah. Oh, right.
Stay in your lane,
call me
Barb.
too. You don't only have to call
Stay in your lane. Stay in your lane, Barb.
And I think the town is very lucky to have, between Jen and Marcy, the resources that you've got in front of you are huge.
And I would like to see us collaborate more. Like I think like with the blood pressure stuff, like I think that would be, I asked Jen if I can continue to go to the schoolhouse so I can keep eyes on those residents. And so I'll be bugging.
So we are.
Will we be starting a formal search, or are we going to see how it works for a while? And
I think for at least for now, we're going to keep her in as interim, and then I think speaking with the commission, speaking with the first selectman, and making a decision kind of what that plan is.
Yeah, I know when we look at our department, so we've had some change in certainly with our grants dictated by budget primarily, also maybe philosophy. That's one thing. So in some ways, we're a slightly smaller department. Second thing, I mean, having worked as we all have with Bethany over these years, I mean, to me, that is a big full-time job. This is no negative reflection on Marcy, but I have questions about whether Marcy can wear 2 hats. We do not want to compromise our senior citizens, needy senior citizens' minds. And on the flip side of that, we don't want to compromise Human Services Department. So it'll be a little challenge, but I think this summer will give you time to weigh it out and see whether you can do it all, because you do have to, not only wearing two hats, but being in multiple places at different times. So,
and I do have good working relationships with some of the other department heads in human services in other towns. And there are models where, you know, the director is a working social worker. And I think, you know, like this summer, I will take the opportunity to be a working director and do my role as well as the role of director. And we'll see how that works out. And, you know, if it means that we need someone full-time, you know, in the office to represent us while I'm out doing home visits and Jackie's out doing visits to the school or the library, then that may be a good answer, as long as that person has some sort of psychology background or something like that.
Another question. Will Enza continue to be a part-time person as part of this thing, and or if you're going to have
she's been great. She's been sort of morphing. She has offered to be the afternoon person in our office while still working for the other departments, as long as we didn't mind that she be doing that on her computer. It's really like our afternoons are mostly making appointments and phone calls and random walk-ins. And so she really knows the clientele well. So for the summer, I think that may be what we're going to do. And then we'll figure out, like, if it's just too overwhelming, we'll figure that out. But until then, that's.
So afternoon is a busier time for you and more appropriate.
It's a busier, like, walk-ins, phone calls, things like that. And I tend to be out a lot doing either, like, you know, I do 3 different groups. I do home visits. I will, you know, people who can't drive, I'll help them with like state program stuff at their houses. So I feel more comfortable having somebody in the office.
Right. Marcy, you mentioned that you have contacts at the other towns and familiar, and I know it's very early, but do you have any impressions as to some things that other towns do that might be worth considering here? Just certain procedures or approaches or organizational models?
Well, like I said, being a working director, I think is a nice model to have. I do see myself being out a little bit more in like doing presentations, like, you know, to PEO and all of the smaller groups in here. And sort of explaining what it is that human services does. I know that Bethany did that a couple of years ago, and then COVID hit, and then, you know, routines just changed. So those are things I see myself doing.
I would encourage you to keep good track of your time and make sure that, you know, you're not overwhelmed by the different tasks for the different roles.
And all those monies are going to remain in her budget, so nobody's going to come in and swipe those out. So, like I said, we don't. Marcy doesn't know.
Is that a guarantee?
Yeah. So she may need those monies, so that will stay.
Well, one concern I would have is that administrative job has always been more of a functional. It is not a purely administrative thing, and she does actual contact with the customer.
So it has to be something.
And so if you're going to be a one-arm paper hanger, you're going to need help, I think, eventually.
Well, just please know we're all here collectively to support you, whatever you need, and know that there's a lot of nonprofits out there that you can reach out to, and I will certainly, from Waveney Life Cares Network, if there's home visits or something of that nature that you need to get on, if you feel stretched in any way, we're happy to send out one of our social workers, or happy to help out and augment in any way that we can. Just feel free to ask. Okay.
Thank you, Marcy.
Thank you.
Well, welcome, congratulations.
Yes, welcome.
Thank you.
So our next meeting, so traditionally, Health and Human Services hasn't met in August.
Thank you, Cheryl.
Since I've been there, when the July date fell on the 4th, there was no meeting. So there was going to be no meeting, and then with Bethany resigning, et cetera, I thought we probably should meet. So July 2nd, I mean, there's input here whether you want to meet, not meet, and the dates. So July 2nd would be a proposed date, if that works for the majority of you. First of all those in favor of a meeting in July,
yeah, that's kind of a
raise their hand.
Yeah, I would
I'm in favor of a meeting in July.
Yeah. How about July 11th?
Yeah, how about the week after?
I thought, well, I posed the July 2nd. Does that work for, I did speak
Not
to.
for me.
Not for me either.
Not for you? Okay, who else besides?
I can't do it Tuesday.
Okay, so you can't do a Tuesday?
What about the following Thursday?
11th.
The following Thursday, the 11th is a possibility. Does that work for?
I can do the 11th.
I will not be here.
On the 11th?
Yikes.
Okay.
I'll do it again. I can do your minutes. I can do minutes again. I did it.
It's okay if I can't be here.
Right.
I did it once.
Okay, so it looks like the 11th works for the majority, most people. All right, I will check and see if that works for Lauren Patterson. She was fine with the 2nd.
Oh, right.
Okay, if she can't do the 11th or whatever, I think we'll move it back to the
Forgot about
2nd,
Lauren.
even though we won't have it.
And I'll just remind the commission, we will have to post that.
Yeah, it's gonna be a special meeting.
Yeah.
Thank you, Russ, for that.
To keep you in line.
I'm just going by the rules and regulations that Alyssa had laid out there. The Alyssa rules of.
Okay, Russ, your other job? Your other job, no, not the liaison, but just. Motion.
Oh, I'm sorry. Motion, I got caught up by motion to adjourn.
All those in favor?
Next meeting, we talked about our priority discussion. We were gonna, I think, talk about that today, but other things have happened that we've had to address, and I would like to bring that back up and just we come out with 3, and just to codify that, I think would be a good thing.
Priorities.
Right,
Yeah.
follow up, yeah. Good idea.
Well, and particularly after Lauren's here, I think there's, particularly with the change of organization, with the more active roles.
Right, and she can talk about how it's easy to get funding for some things and not for others, and that can help guide us.
I would also have some questions worked out ahead of time and ideas, suggestions.
For the survey, for the town survey.
Yeah.
I agree.
Yeah, I do think this is a potentially interesting moment. You know, we've got a new first selectman who's interested and probably has some sort of vision that we can build around along with the survey results, which will give us data that we've never really had before. So it's a real nice moment of opportunity to kind of refine what we're doing as a mission, and of course working with staff, but be a little bit clear about our role, where we can serve, how we can be full help to the town. So I think this meeting in July and definitely once will be really, really important.
Okay.
Okay, thank you all.
Formal meeting, motion to adjourn.
All those in favor? Thank you.
Oh my God.
Your job, Russ.
Russ should have been.
Yeah, but my daughter's having a baby.
Oh.
We're going like mid-June to the end of June. Yeah. Oh, do you want to get together?
Always do, but.
Yeah, maybe.
No,
We'll
just,
I know, we're going to Dr. Butler today.
You're the 11th.
Maybe you guys could just come over for a drink too.
Yeah. It's,
Bring dinner. We've
going
had,
back to the,
going to see how the
that surgeon, the one who.
You know what, everybody keeps saying, then you try